known as the pingdemic, but the NHS COVID app's job is to track infections. Is it working or is it broken? Well, let's look at the data. The NHS app sent over 520,000 alerts the week ending the 7th of July, instructing users to isolate because they had been in close contact with someone who had tested positive for coronavirus. It's the app's job to track infections, and so we should be seeing more contacts as virus infection numbers increase. Here are the cases for England. You can see both the lines for cases and alerts rising together. If you look closely at a local level in South Tyneside, which is one of the highest infection rates in England, it follows the same trend: a rise in infections, a rise in alerts. It is keeping pace with infections. Tracking infections only works if people continue to use the app. And this is now the concern. This chart shows the number of check-ins. This is when people go into a venue, and recently they seem to be declining across England. We don't know why this is. Is it because people are switching off the app, or is it because people are being more cautious and not going out as much? In other words, self-isolating. To help us better understand what might be happening, we can look at mobility data for the UK. The numbers are negative as it is compared to pre-pandemic levels. Recently, numbers have remained level, suggesting people are still visiting venues and potentially choosing to use the app less. We know the app is causing disruption for businesses and employers, but experts still say test, trace and isolate is crucial for the way out of this pandemic.
Test, trace and isolate is the best way of handling any infectious disease pandemic. And it's absolutely crucial that we stick to it and that we make sure all parts of it work. The app is an important part of that, of the armour we have in test, trace and isolate.
The data suggests the app is doing the job it was designed to do, but the more disruption it causes, and if more people lose confidence in it, then there is a danger many will switch it off. That could leave us in a worse position, as then we lose our ability to reliably monitor infections.